Hi, Dr. Saxena here, and continuing from where we're talking about the role of this oral health when it comes to we spoke about something like oral bacteremia and all that causing asymptomatic bacteremia, and the load is more that causes a there is a good number of studies which were done, and I would like to open up that particular thing because I believe this atherosclerosis is not just the cholesterol which is causing a problem. There has to be some thing else also. So we are looking at the infectious disease agents as a possible causative factor in the cardiovascular disease, and this work was peer reviewed, and the papers were presented by Aristo Vojdani, and we have now several lines of evidence suggesting that chlamydia pneumonia can make its way into the walls of the various blood vessels and linger for years, and possibly induce the inflammation and reactive and immune reactions. So at present there is association between the Helicobacter pylori, which we always believe it is because it's only causing gastric ulcers and all that, and the cardiovascular disease, and is mainly serologic. The association is mainly serologic, as Helicobacter is not being detected in the walls of the atherosclerotic arteries. See, there were many viruses and bacteria. They were isolated from the atherosclerotic plaque. Among them, you have got something like dental and oral pathogens, which we have already spoken about some of the things. And apart from that, I would like to this particular chlamydia. Chlamydia is a very, I think, is the strongest association, has got a strongest association with this cardiovascular disease, and this particular stuff, this contributes, this infectious diseases agents can also contribute to acceleration of this atherosclerotic development, either by non-specific mechanisms such as hypocoagulation, increased production of adhesion molecules, and elevated C-reactive proteins. We always try to look at this thing, what is this level of the C-reactive protein with the patient, so that we know what are this is basically for us is an inflammatory marker. The more the inflammation, the more likely the patient is going in for some problems. So this is what we have been talking about. What is the so when we looked at chlamydia pneumonia, this is one of the I think this is one of the simplest thing. It was named Taiwan acute respiratory disease, and chlamydia is less known. It is usually the sexually transmitted disease. There are something like chlamydia, the same pneumonia is there, chlamydia trachomatis is there, which or chlamydia conjunctivitis, which is Cetaceae. So this is, but chlamydia pneumonia is far more widespread, and it's far more dangerous than the other two things. There are several lines of evidence suggests that chlamydia pneumonia can make its way into the walls of the various blood vessels and linger for years. So this is one of the things. Evidence suggests that the leading cause of the death, atherosclerosis, is to some degree contagious, and common antibiotics can help bring it under control. There are more than 50 articles which were studied with chlamydia pneumonia, and there were PCR assays were done for this chlamydia pneumonia, DNA and all that, and high titers of chlamydia pneumonia, IgG, IgM and IgA, and circulating immune complexes were detected, and significantly this were associated with acute episodes of transient ischemic attacks, or you have got something like CVAs also, and this was talking about from a peer-reviewed journal. And there is an intranasal infection of rabbits. There is an intranasal infection of rabbits with chlamydia pneumonia. Is resulted in accelerated atherosclerosis, which was shown in the animal studies. 3 months after inoculation of this chlamydia pneumonia, there is a kind of incessant activity of atherosclerosis that happened in the this particular intranasal infection with the rabbits and all that. So this what it proves that again there were studies azithromycin antibiotic after exposure to infectious agents prevented this accelerated intimal thickening. So we need to understand what can happen with animals can happen with the human beings also. So this particular correlation between the correction with the germs and atherosclerosis is not a new thing, and we believe the chlamydia pneumonia, the chlamydia is one of the thing, and other things also people have worked on that, which was H. pylori, but it couldn't be proved because of H. pylori is not detected in this particular thing, but there are antibodies to H. pylori were detected. And I can always tell you this happens over the years. You may get the chlamydia pneumonia sometime back in your childhood or your H. pylori and all that, and you can always get the symptoms quite late in this one. So this particular thing which I always believe, you need to look at your oral hygiene. You start your thing from mouth, and if you are having into something like bad oral hygiene, I strongly advise you not just go for the brushing or with the paste and all that. You should always look into something like flossing, which our dental friends has taught us how to go with this flossing and all that. And apart from that, I try to work with something, people having that epigingivitis in a big way. We try to use our dentists and friends and try to work on that with a laser also, and I can always tell you it's an amazing kind of things what I picked up while with my dental doctor friends. And this is one thing which always I believe, if I am able to cut down that body, if I am able to improve that oral hygiene, I'm getting very good dividends. My patient doesn't get into he doesn't get into severe problems in spite of any kind of blocks he has got. So this is the thing which I was really excited to share with all of you, and I think this must be a thing which should be easily taken out. People should always look for brushing the teeth twice daily, trying to do a flossing. Flossing is a simple process, spraying the jet of water into the ear thing, because the particles and all that, whatever they are stuck, which can cause that bacteria to grow more. And the third thing what you can always do is oil pulling. Oil pulling is a very interesting stuff, and you should always look into that to avoid cardiac problems and the kind of which we always used to think it's only the lifestyle thing. You need to cut that inflammation. Once you cut that inflammation, try to stop that inflammation, I'm sure you're not going to get into any problems. Thank you.